Scene, hospital recovery room, a few days after Mrs. Tran started treatment. She is sitting up in bed, wearing a nasal cannula for oxygen support. Her husband, Mr. Tran, sits beside her, gently holding her hand. Nurse Olivia enters, carrying a clipboard. First days of treatment. Nurse Olivia, smiling, "Good morning, Mrs. Tran. How are you feeling today?" Mrs. Tran, weakly, "A little better, but still short of breath." Nurse Olivia, "That's expected. Your lungs are adjusting to the medication, and your body is still recovering from the last flare-up. But the good news is your oxygen levels are improving." Mr. Tran, hopeful, "So she's getting better?" Nurse Olivia, "Yes, she's responding well to the treatment, but managing COPD is a long-term process. The goal isn't just to treat symptoms but to keep them from getting worse." Mrs. Tran, sighs, "It's hard to accept that this won't go away." Nurse Olivia, "I know it's tough, but you're doing everything right. And we're here to support you every step of the way." Dr. Carter enters the room, holding Mrs. Tran's latest test results. Doctor's check-in. Dr. Carter, "Good morning, Mrs. Tran. I've been reviewing your progress and I have some positive news. Your lungs are responding to the bronchodilators and your oxygen levels are more stable. If this continues, you may not need the oxygen therapy full-time." Mrs. Tran, surprised, "Really? I thought I'd be stuck with this forever." Dr. Carter, "You may still need it occasionally, especially during activity, but with the right rehab and breathing exercises, you can regain some lung function and improve your endurance." Mr. Tran, relieved, "That's great news. Dr. Carter. Yes, but there's more work to do. Your next step is pulmonary rehabilitation. Our respiratory therapist, Alex, will guide you through breathing techniques, light exercises, and ways to conserve your energy while staying active. Pulmonary rehabilitation begins. Later that day in the hospital's rehab center. Mrs. Tran is seated in a chair, connected to an oxygen monitor. Respiratory therapist Alex kneels beside her, demonstrating a breathing exercise. Respiratory therapist Alex. Mrs. Tran, one of the most important techniques for COPD is pursed lip breathing. It helps control shortness of breath and improves oxygen flow. Let's try it together. Mrs. Tran nods. Okay, what do I do? Respiratory therapist Alex. Take a slow breath in through your nose. Pauses while she inhales. Now purse your lips like you're about to whistle and slowly breathe out. Mrs. Tran follows along, like this. Exhale slowly. Respiratory therapist Alex. Perfect. That helps prevent air from getting trapped in your lungs. Do this whenever you feel short of breath. Mr. Tran, watching, that actually looks helpful. Respiratory therapist Alex, it really is. We'll also work on gentle exercises to improve stamina. COPD doesn't mean you have to stop living. Our goal is to help you move with less effort. Mrs. Tran, determined, I want that. I want to be able to walk without feeling like I'm drowning. Respiratory therapist Alex, and you will. It'll take time, but I've seen many patients regain their strength. A new beginning. A week later, back in Mrs. Tran's hospital room. She is sitting up, looking much stronger. Dr. Carter and Nurse Olivia enter to discuss her discharge plan. Dr. Carter: Mrs. Tran, I'm happy to say you're ready to go home. Mrs. Tran, smiling, really? Nurse Olivia: yes. You've made great progress. You'll continue pulmonary rehab as an outpatient and follow a home exercise plan. Dr. Carter: the key now is to avoid lung infections. That means staying away from smoke, dust, and strong fumes, getting vaccinated, and recognizing early signs of worsening symptoms. Mr. Tran nods. We'll be careful. I'll make sure she follows all the instructions. Mrs. Tran, holding his hand: I'm lucky to have you. Dr. Carter, smiling: and we're lucky to have patients like you who are willing to fight for their health. Remember, COPD is a lifelong condition, but it doesn't have to control your life. You're in charge. Mrs. Tran nods, taking a deep breath, one step at a time. Mr. Tran, smiling: and I'll be right beside you. The scene fades as Mrs. Tran is wheeled out of the hospital, ready to start a new chapter of her life with hope and determination.